it quite useful seeing the patient in front of me and knowing how quickly things could change from having that chest pain to having breathing difficulties, and then having someone in the team that can help you suggest what to do next. I found it helpful having someone in front of me to help.
As time went on and you were doing all the various things, at one stage there was an awful lot of faces around the bed, and having supposedly just come out of an operation and not feeling the best in the world, to have all these faces very close to you, all around the bed, can be quite unnerving and a bit frightening. So do think about that. I know you all want to be there and you all want to chip in, but do think about maybe just stepping back a little bit.
I thought it was good the way he was working in teams. You could delegate each person to a certain role. So someone would go and check the wound, someone would be able to give the drugs, someone would actually introduce everyone to the patient instead of having 4 faces in their face. That would be a bit daunting at times. So just the approaching towards the patient is just good to be able to practice in uni as well as out in placement.
I thought it was helpful to learn about different procedures I haven't learned about in the hospital, out of hospital, so it gives you a chance to think about what you've got to do rather than having the pressure to do it there and then. Doing it here, you do get a chance to think about what needs to be done and what you're going to do without having to rush and be pressured to do it straight away.
I just learned the importance of listening to the patient. Like at one stage I said, "Oh, don't worry," and she said, "Of course I'm going to worry," which is right. Just think of ways how to reassure and comfort them.
For me, it's probably the importance of reassuring your patient and the effect that can have actually on making them feel a bit better. Because if you're not just there to do the clinical side, you've actually got to reassure, make sure they're all right. I think that can have an effect on the way that they're feeling, and it's probably given me more confidence in. Now I can go and talk to a patient. It's given me more confidence in things that I can say to reassure a patient.
I agree with Georgia, although the clinical side may not be clear to all of us, it's lovely to have the service users there in person, because it does make you realise that people are individuals and everybody acts in different ways. So maybe a little bit brushing up on the clinical side, but it's nice to have that interaction one-on-one.
It's good to have service users like that, because before we go to the actual hospital working in there, it's going to be really different.
Yeah.
To just build up more experience. It's good to have service users, and I haven't dealt with any of the, but it's been long, and it was good.
It's about teamwork and delegation, and actually having the service users was good because it gives me hands-on to know that it's real patient I'm dealing with, and it's a good session and I'm happy I did it.
Hi there, we're second year students at Anglia Ruskin University. My name's Andrew.
My name's Georgia.
My name's Paul.
And I'm Sally. Well, as student nurses, we haven't always had the most experience maybe with certain procedures or with people. So service users or volunteers coming in from the outside who have experienced healthcare and have been in hospital for certain procedures, it's really good for them to come in, and they can also give us feedback after we've sort of cared for them and done role play, and it's really useful to practice our communication skills and have a bit of feedback from real people who have experienced it. So that's good.
I think it's very good that we have service users coming from the public in our skills session, from going out on placement and actually meeting patients, and then coming back into uni to go over our skills again before we actually go out to placement. I think it's very good for all of the students here at Anglia Ruskin. Obviously, we've spoke a lot about the feedback that we get from the service users, and obviously that's gonna give us a positive return when we're actually getting that from them. So we'll be able to take that away, reflect on that, and put it into our future practice, which is very good.
And even when getting feedback, obviously when we're in practice, the patients do tend to rely on us and do listen to what we say. So they may not feel comfortable telling us how we come across to them, because obviously we're in the workplace to learn and as well as trying to help people. So here, the patients the service users that come in to help us, they don't feel that they need to hold back necessarily. So it really does help with us trying to develop.
Yeah, so we really do value the volunteers that come in. It's really useful to us. It helps us develop our skills, and as well, like everyone here said, the feedback's really good and it's really useful to us. So we really do value the volunteer service users that come in
and appreciate them. We appreciate them giving their time to help us, and we are all really genuinely appreciative of that.
The use of letters rather than telling me what you're going to do. I don't know the official phrase for it, but you say things like IV. When I'm a patient, I'm not feeling very well. I don't want, my brain is not computing properly, and therefore I don't fully understand what you mean by IV. You need to spell these things out and explain exactly what it is. But I think that will come in time and with practice.